So rheumatoid arthritis mainly affects the joints, and hence the symptoms are mainly pertaining to the joints. So most patients will complain to us of pain in the joints involving the fingers, the toes, the knees, hips, shoulders and elbows, and this pain is most severe in the morning hours. So when they get up in the morning, they have the worst pain, and they also feel a lot of stiffness in their joints. They feel difficulty in making a fist, they cannot bend, they cannot go to the toilet, sit down or get up. So this kind of stiffness, what we call early morning stiffness, which lasts for about 30 minutes or more than 1 hour in some patients, are the most important symptoms. Most patients will also have swelling of the joints which are limited to the joints. They may notice swelling of those joints which are involved, and also over time, if you don't adequately treat these patients, they will develop deformed joints or bent joints. So you may have a permanent bending of the joints of the fingers, of the knees. They may not be able to open their knees, straighten their knees, or may not be able to do even basic daily activities like brushing or walking, going to the toilet or dressing oneself. So the symptoms will vary depending upon the duration of the disease. Initially it is mainly pain, swelling and stiffness of the joints, and over time it is all due to damage or deformed joints. The diagnosis of rheumatoid arthritis is mainly clinical, in the sense that a physician or a rheumatologist would see the patient, see the symptoms of the patients, and then decide whether this is rheumatoid arthritis or there is some other disease which may be existing in that patient. We may use some blood tests or laboratory tests to help us in this diagnosis, for example rheumatoid factor, anti-CCP and many other tests, but they are not the tests which will decide whether a patient has got rheumatoid arthritis or not. A diagnosis of rheumatoid arthritis rests on a history, that is what the patient tells to the rheumatologist, as well as the clinical examination on seeing a patient. What are the things we see in a patient, and that is how we diagnose rheumatoid arthritis. Labs definitely will help us, but they are not the ones which will decide whether a patient has RA or not.